Full range of motion of the cervical region requires that you position the patient with his or her head off the table. Grasp the occipital region securely, then flex the spine. Nod the head on the neck, and then continue flexing the spine by moving the chin towards the sternum. For lateral flexion, keep the spine neutral to flexion extension while moving the ear towards the shoulder. Rotate the spine by turning the head from side to side or from left to right.
Exercises for cervical spine active range of motion. For extension, ask the patient to move the head backwards with assistance. For flexion, ask the patient to move the chin towards the chest with assistance. For lateral flexion, ask the patient to bend the neck, moving head towards the right with assistance and then to the left with assistance. For rotation, ask the patient to turn face going to the right with assistance and then to the left with assistance. Exercises for cervical active range of motion. For flexion, ask the patient to move the chin towards the chest. For extension, ask the patient to move the head backwards. For lateral flexion, ask the patient to bend the neck, moving head towards the right and then to the left. For rotation, ask the patient to turn face going to the right and then to the left.
In order to flex the pelvis on the lumbar spine, flex the hips and knees of both lower extremities and bring the knees towards the patient's chest. If the patient is very flexible, you may have to reach under the pelvis or the buttocks and lift the pelvis upward. For rotation of the spine, begin with the patient in the hook-lying position. Stabilize the thorax using a hand on the opposite shoulder. Push the knees laterally in one direction until the pelvis of the opposite side comes up off the table.
Exercises for lumbar spine assistive active range of motion. For flexion, ask the patient to bend forward like reaching the floor with assistance. For extension, ask the patient to lean backwards with assistance. For rotation, ask the patient to cross arms and then ask her to turn the upper body going to the right and then to the left. Exercises for lumbar spine active range of motion. For flexion, ask the patient to bend forward like reaching the floor. For extension, ask the patient to place both hands on waist and then lean backwards. For rotation, ask the patient to cross arms and turn the upper body going to the right and then to the left.